Hi, my name is Catherine Price. I'm a physical therapist. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. Today I'm going to go over 3 moves that can completely eliminate low back pain. First, I want to start with a word of life from Psalms 30:4-6. Sing the praises of the Lord, you his faithful people. Praise his holy name. For his anger lasts only a moment, but his favor lasts a lifetime. Weeping may stay for the night, but rejoicing comes in the morning. Amen. So today I'm going to go over 3 moves that can completely eliminate low back pain. First, you do want to go have a physical therapist assess you to make sure these are appropriate exercises for you. So what I do is I have my patient, or I myself will stand. I'm going to bend backwards and assess, do I have pain? And yes, I have mild discomfort when I bend backwards. Then I'm going to bend forwards. Do I have pain? No, I don't. I'm going to bend to my right. Do I have pain? No. I'm going to bend to the left. Do I have pain? Very mild discomfort on the right. Then I'm going to rotate my body left. Do I have pain or stiffness? Rotate to the right. Do I have pain or stiffness? And I find that I have an easier time rotating left than I do right. So I'm going to assess for imbalances and discomfort, and the pain pattern does make a difference as if these are appropriate for you. If you have pain only bending forward and no other directions are giving you pain, no pain bending backwards, this may not be appropriate for you. So if you have pain both backward bending and forward bending, it's possible that it could be appropriate for you. If you have pain only in back bending and not in forward bending, it's most likely more appropriate for you to do these. So the first exercise that I'm going to show you is going to address the latissimus dorsi muscle. The latissimus dorsi muscle is going to be activated when you're running, when you're walking, when you're rotating your spine. It goes from T7, the bottom of the close to where the shoulder blades are, that bottom level in the spine, all the way down to T12, so the bottom of the thoracic spine. It also attaches to the iliac crest, to the hip area. Every muscle that I go over today is going to be attached or involved in the pelvis region. So you may have no pain when you lie down, and you find that there's some low back discomfort when you're either sitting or standing. The pelvis is affected when you sit or you stand. So the latissimus dorsi is the first muscle I'm going to address. You can use a larger foam roller to begin with, and then go to a more firm roller as you are able to tolerate. Some of these areas can be very tender if they've never been addressed. So I'm going to place this roller behind my back. I'm going to go up high, so just below my shoulder blades, and I'm going to support my head and neck. I'm only going to roll along the spine from T7 to T12. So I'm going to stay on my rib cage on the back. And so I'm just going to mobilize the connective tissue and muscle in that area. Then I'm going to slightly angle myself to one side and roll slowly on the lower part of the rib cage. And then I will angle to the other side and go slowly along the rib cage. If you find an area that is tender or tense, you can then rock back and forth to release the tension over that area. So I'm just staying on the rib cage, but I'm going between T7 and T12, which is just going to be from the bottom of the shoulder blade along the rib to the bottom of the rib cage, and that is it. So I'm going to release the tension there. Then that muscle, the latissimus dorsi, is going to attach into the shoulder. So I am going to go on my side and follow that line all the way up to underneath my shoulder. So I'm going to mobilize that connective tissue and muscle. So I'm going to find an area of tension or tenderness and gently rock backward and forward. So this is a good way to get some body awareness, body feedback. find areas that may be problematic to you. And you want to spend about 2 or 3 minutes to mobilize the connective tissue. After you have mobilized the connective tissue on one side, or the lats on one side, I'm going to then switch to the other side. So I'll mobilize the left. And you may find that one side is more tense or tender than the other. And you want to spend more time on the area of tension than the other. Now, after you have released the latissimus muscle, you then want to stretch it. So I'm going to go into a stretch. And this stretch is going to be beneficial because it is addressing multiple areas. So what I'm going to use is the back of a chair. I'm going to drop my chest down, keep my knees straight, and I'm just going to hold this stretch anywhere from 30 seconds to a minute. When you do this, you should feel a nice stretch in the shoulders, underneath the shoulders. As you drop your chest down even more, you may find you get more of a stretch. Now, you're also stretching the back of the legs, the hamstrings, so you may feel a pull back there. This is going to be beneficial. The hamstrings attached to the pelvis region, so you're also stretching those muscles that attach there. And you just want to take nice deep breaths in and all the way out. And deep breath in and all the way out. And then walking back up out of that, you want to relax the shoulders, let everything go loose, and then you want to go back into that stretch again. And dropping your chest down. Now, as you do this, you want to take your pelvis and you want to try to tilt your buttocks towards the ceiling and further lengthen the back of the legs. Now, you don't want to tighten the low back, and what you can do is you can shift your weight from right to left, and that you should further feel a stretch in the latissimus muscle and in the side. So if I shift my weight to my left foot, I should feel a stretch through the right side. I can go back to the right and I should feel a stretch through the left side. And then hanging out, taking a deep breath and all the way out and coming back up. Doing some shoulder rolls just to let everything relax. And I'm going to go for one more stretch. So I like to do 3 times 30 seconds, holding this stretch, breathing in, and when you breathe in, you want to try to pull the air in from the bottom of the ribs. So I'm trying to expand the bottom of the ribs. And again, dropping my chest and tilting my buttocks towards the ceiling. So that is going to be my lat stretch. Then I am going to come down onto the floor and I am going to go into a hip flexor stretch. I'm going to bring my right leg to the outside of my right hand and I'm going to be in this position. If you've not done this before, this may be as far as you get. You should get a stretch on the front of the back leg and the inner thigh groin area on the opposite leg, the leg that is in front. Now, if this is easy, you want to work your way down so that your elbows are on the floor, and that intensifies that stretch on the inner thigh on your side of the leg that is forward. Now this is going to stretch muscles that are attached to the pelvis, and it's also going to stretch the muscle that is attached to the low back. So I'm going to then alternate, and again, this may be where you start, and your hands is going to go on the inside of that foot, and just hold this position, stretching the front of the back leg and the upper inner thigh on the leg that is forward. And as I am able, I am going to go down onto my elbows, and I'm going to hold this. I want to do 3 times, 30 seconds at least on these. Same as the latissimus stretch. So this is important. Your hip flexor, the psoas, it's going to be attached to L5 and not S1. L5, S1 is one of the most mobile areas of the back, and if that muscle is tight, it can further strain L5, S1, where most back problems occur. And the majority of back problems are going to occur at L4, L5, or L5, S1. And then I'm just going to alternate back and forth and holding this for 30 seconds. So we're addressing the low back by addressing attachments of, or addressing the muscles that are influencing the pelvic region. And alternating to the other side, left leg in front, dropping down, holding this. Now, if you find that one side has more difficulty than the other in this stretch, your physical therapist can help you find those areas to release them and to help you balance this. This is really good too, because there are different types of pelvic dysfunctions, and just by doing this stretch can help correct those dysfunctions. And that is one reason too, when you clear the pelvic dysfunction, it helps the lower back. And I'm going to do one more on each side. Taking a deep breath in, all the way out. Deep breath in, all the way out. And switch for one more stretch. Deep breath in, all the way out. Deep breath in, all the way out. And if you have any questions, please feel free to put them in the comments, and I will respond as soon as I am able to do so. And I will come out of that. So now I'll go back to recheck. I'm going to bend backwards. Do I have any pain? No. I'm going to go down to the right. Do I have pain? No. I'm going to go down to the left. Do I have pain? No. And then I'm going to bend forward. So you can then recheck after you go through them and find out if this is an effective approach to addressing your low back pain. Hope this was of help, and have a blessed day. Thank you.